some people living with thyroid disease but yet has persistent symptoms after their thyroid functions become normal on the blood test result. We see this in some patients, and one of the major cause of this is it depends on how long they have an undiagnosed thyroid disease. If they have the undiagnosed thyroid disease for a couple of months, then the implication of that condition would already be implicated in the muscle, the heart, and their brain. And hence, sometimes it takes a few more months for the body to recover. And one of the very good tips for the patient will be to start exercising, for instance, to build up their muscle bulk and use their muscle, and adopt a healthy lifestyle and diet once their thyroid function is back to normal, as this will help with the recovery of their thyroid status or thyroid health in overall. And the other aspect of thyroid health is in hypothyroidism. A lot of patients felt tired or have persistent symptoms despite normal thyroid functions after adequate replaced with levothyroxines or thyroid hormone replacement. And one of the possibility is because they have a lot of condition that is not related to hypothyroidism, and this is very important for the patient to actually seek help if their symptoms persist after 4 to 6 months after adequately treated, just to avoid another diagnosis actually being missed. There's not really any specific thyroid diet that could help or cure thyroid conditions. And however, it depends on the kind of diagnosis that a patient has. For instance, in thyrotoxicosis or excessive thyroid hormone, we would advise patients to avoid a diet containing high iodine, like shellfish, seafood, or kelp, seaweeds, and things that contain high iodine. And on the other hand, certain supplement has been proven to help with certain thyroid conditions like thyroid eye disease with selenium. And apart from that, there is no evidence to suggest that having a dairy-free or a gluten-free diet is going to change the outlook or cure any thyroid conditions. There is no long-term complication or ill effects of carbimazole if a patient is tolerating it well without any side effects. Having said that, if someone choose to take carbimazole for long-term instead of having definitive therapy, he or she has to bear in mind that carbimazole has the ever-present risk of causing agranulocytosis or lower your white blood cell. And this is a condition where it could happen any time point as long as you are on carbimazole. And the patient who is on long-term carbimazole just have to remember about the symptoms to look out for instance, very high fever, severe sore throat, or have lots of ulcer in their mouth. And they will have to stop the medication and get their blood test done to make sure they do not have a suppressed white blood cell count. So this is basically one of the precautions they have to remember as long as they are on carbimazole. The other thing to bear in mind is if they choose to have long-term carbimazole, then definitive therapy, then there is a risk of intermittent uncontrolled thyrotoxicosis in the context of hyperthyroidism. And they are studies proven that patients on long-term anti-thyroid drugs with intermittent control has worse outcome in terms of cardiovascular health and also premature death as well. We usually recommend patients to take levothyroxine first thing in the morning on the empty stomach with water only, and live for about 45 minutes to an hour before having their breakfast. However, there's not really the best time to take levothyroxine, as every individual is different. So I would say the best time for an individual to take levothyroxine is the time where someone can remember to take it every day, and the circumstances allow the person to take it on an empty stomach at least an hour before having any food or medication that can interfere with the absorption of levothyroxine. And so, it's not really fixated that everyone have to take it first thing in the morning, but it is ideal as you will be fasted. Most people will be fasted for more than 7 hours from overnight before they take levothyroxine. A small proportion of patients who require thyroid hormone replacement are allergy or having intolerance towards levothyroxine. So liothyronine will be the option for this group of patients. Outside of such context, liothyronine on the current preparation form has not been proven in more than 12 randomized control trials to be more superior than levothyroxine. I'm not dispute some patients felt better on the combined liothyronine and levothyroxine treatment. However, as there are currently lack of strong evidence to support the use of liothyronine in everybody, we wouldn't recommend it as a standard treatment. If a patient having persistent symptoms, and despite levothyroxine, I would like to have a trial of liothyronine, I would first rule out all the potential causes that contribute to the persistent symptoms. And if patient is still debilitated by the symptoms, then I will give a short trial or a short course of liothyronine combined with levothyroxine, with the caveat that after 6 months, we should consider stop it if there's no measurable or significant improvement. And I tend to use the thyroid-specific questionnaire like ThyPro to measure any significant change.